FEFU is a federal university, which by its own is quite prestigious here.
In FEFU, you will work with real doctors, not just with professors who know just theoretic part of some subjects. On our lessons, we use only English.
We only start with anatomy, but then it's brought out in other subjects as well.
And we have real dead body in our museum. We have some specific organocomplex.
Anatomy is like a queen of medical studies.
Exam in FEFU, it is like a big holiday. Everybody come to exam in a white coat, they smile to us.
Hello everyone, welcome to our special interview session. Today we are honored to have with us the senior faculties of Far Eastern Federal University of Anatomy Department, Mr. Andrei Viktorovich and Mr. Roman Fedorovich. Sir, also can you please introduce yourself?
Yes, my name is Bondry Andrei Viktorovich. I teach first year of education here at FEFU, and I teach anatomy classes.
My name is Tormasov Roman Fedorovich. I'm working in a FEFU, like professor of normal anatomy, with different students from different countries, and I enjoy it.
To begin with, sir, could you please give us an overview of Far Eastern Federal University and its general medicine program, which is also known as MBBS in India, and its reputation in the field of medicine, the reputation of Far Eastern Federal University in the field of medicine. So if you can provide us an overview.
First of all, FEFU is a federal university, which by its own is quite prestigious here and in other countries also. It's if I remember correctly, it's 600 in score rate of universities. And we teach different types of students from different countries here. We have a program of 6 years of education. We only start with anatomy, but then it's brought out in other subjects as well. What else?
Sir, I want to know that basically what makes the general medicine program or MBBS program unique in Far Eastern Federal University in comparison to the other institutes.
Our program at FEFU have many practical training, which I think can help the students even more than theoretical courses, though they are important, of course, as well. We have our own medical center in the next building to our educational center. Students can have the ability to go there to look, for example, at the autopsies to better understand the anatomy, because we are talking about it here. Yeah.
In FEFU, you will work with real doctors, not just with professors who know just theoretic part of some subjects. You will work like a doctor who have their own practice in a real clinic, and you will meet with specific cases of different patients.
Okay, thank you, sir. So, sir, my question is, how do you teach and what is the importance basically of anatomy in general medicine program, and how do you teach anatomy to international students or to Russian students? Can you please explain it?
No, the anatomy is like a queen of medical studies. Basically, it's a baseline on which all of the other branches of medicine build on. And if you know anatomy, it will help you gradually in your next studies. This is why we start to teach anatomy from the first year. And of course, we teach it to everyone equally, to the Russian student, to the Indian student, African students. All we teach is in English. We have an international program which is very strong. And basically this is it.
Question will be related to the cadaver and autopsy. So in anatomy, in Far Eastern Federal University, do they conduct an autopsy? Student will get a chance to see the autopsy. And what about cadavers here? So if you can explain it too.
Yes, every student have the ability to go to the real autopsy, see how it performed by a specialist. Yes, sure, it's a very valuable part of our education here.
Yes, and we have real dead body in our museum. We have some specific organocomplex in this building. Yeah.
So, sir, my next question is like you are a senior faculty of anatomy department here in Far Eastern Federal University. So, basically, how is the exam conducted for anatomy in Far Eastern Federal University?
Exam in in FEFU, it is like a big holiday. Everybody come to exam in a white coat. They smile to us, and of course, exams should be in a viva, in an oral format, because we need to check knowledge of all students, and we do that. You will student have a 15 minutes for answering, for preparing, and for answer. Students sit in front of the professor and talking individually. We try to keep quiet in a room, not just because we understand that everybody needs to quiet for thinking. We understand that students can be nervous. It's new area for them. The exam, it's every time stress for people. And when some of students make little mistake, we can close our eyes for this thing.
Yes. Also, it's not like one big event. Yes, we also have colloquiums during our classes, 3 or 4 during all of the year of education, which are basically a small exams of their own. It includes 2 or 3 topics, and the students also orally answer the questions, also there is an individual approach in it, yes, which we don't have, for example, in tests and so on. This approach helps us to understand the student by his own, not in the classroom, but like what he will answer, what he will know, how he thinking, what is the chain of events that leads him to the answer, and so on.
So, sir, my next question is related to the language of instruction or medium of instruction.
Mm-hmm.
In which language do you taught the anatomy to the Indian students?
On our lessons, we use only English. We use English on exam. We use English textbook. We use English spaceman. Just only English language. But on a normal anatomy, only on a normal anatomy, we use Latin language too. And you will have a course of Latin language in our university. You will learn it, and you will use it to understand foreign doctors, professors on Latin too.
Okay, thank you so much, sir. Also, sir, can you please tell us, we have a very big team of professors here in Far Eastern Federal University for anatomy, and not just for anatomy, for every subject. So, sir will elaborate this. Sir, can you please tell us about the team of professors for subjects like?
All of our professors, we younger faculty members, we teach from them previously, and now we also, as we grown up and we are the teachers and doctors of our own, we also always stay connected with each other.
I want to say that we are educated here to like a student. It's not a problem for a student ask us. We understand them. We understand their problem. We can help them to understand our discipline and be a good doctor.
Great, sir. Great. So, thank you so much, Professor Andrei Viktorovich and Professor Roman Fedorovich, for your time and to share your experiences with us. Thank you so much for giving you your time. Thank you, viewers. We will meet in next interview. Thank you so much. Thank you so much, sir.
You're welcome.